Question 1. A patient presents for a bilateral mammogram. The radiologist provides the imaging service and a separate, written interpretation and report. Which modifier should be appended to the CPT code for the mammogram? A. 26. B. TC. C. 50. D. No modifier is needed. Answer: D. No modifier is needed. This question tests the concept of global procedures in radiology. The key information is that the same provider, the radiologist, performed both the technical component, the imaging service itself, and the professional component, the interpretation and report. When one provider performs both components, it is considered a global service, and no modifier is required to separate the parts. Modifiers 26, professional component, and TC, technical component, are only used when different entities bill for these services separately. Think of it this way: if the doctor does the whole job, you report the whole code without splitting it up. Question 2. A surgeon performs a complex repair of a 3.0 cm laceration to the neck and a simple repair of a 4.0 cm laceration to the arm. According to CPT guidelines, how should these services be reported? A. Code both the complex and simple repairs. B. Code only the complex repair. C. Code only the simple repair. D. Add the lengths of both repairs and code as one complex repair. Answer: A. Code both the complex and simple repairs. This scenario tests the bundling rules for wound repairs. The key detail is the different classifications of repairs, complex and simple. According to CPT guidelines, when repairs of different classifications, simple, intermediate, complex, are performed, all can be reported separately without bundling the less complex repair into the more complex one. The simple repair would not be considered incidental to the complex repair because it was performed on a different anatomical area, arm versus neck. Remember, you only bundle repairs of the same classification in the same anatomical group, otherwise, you can code each repair separately. Question 3. What is the purpose of an Advance Beneficiary Notice of Non-Coverage, ABN? A. To inform a Medicare beneficiary that a service may not be covered and they may have to pay out of pocket. B. To pre-authorize a service with a commercial insurance carrier. C. To document a patient's consent for a surgical procedure. D. To appeal a denied claim on behalf of a patient. Answer: A. To inform a Medicare beneficiary that a service may not be covered and they may have to pay out of pocket. This question assesses knowledge of Medicare compliance, specifically the ABN. An ABN is a form used to notify a Medicare patient, before a service is rendered, that Medicare will likely deny payment for that specific item or service. This process is crucial because it gives the patient the opportunity to accept or decline the service with full knowledge of their potential financial responsibility. This protects both the provider's ability to collect payment from the patient and the patient's right to make an informed decision. Always remember, an ABN must be signed before providing a potentially non-covered service to a Medicare patient. Question 4. An established patient is seen for a follow-up of their hypertension and diabetes. The provider performs a medically appropriate history and exam and reviews lab results and medication adherence. The medical decision-making is determined to be of low complexity. Which E/M code should be reported? A. 99,203. B. 99,213. C. 99,214. D. 99,202. Answer: B. 99213. This question tests your ability to select the correct office visit evaluation and management, E/M, code based on patient status and medical decision-making, MDM. The keywords are established patient and low complexity MDM/M codes in the 99202 to 99205 range are for new patients, while codes 99212 to 99215 are for established patients, so you can immediately eliminate the new patient codes. Since the MDM was of low complexity, the correct code is 99213, which corresponds to an established patient office visit with low-level MDM. Here's a quick tip. The fourth digit in the E/M office visit code tells you the status. A 0 is for new patients, e.g., 99203, and a 1 is for established patients, e.g., 99213. Question 5. A patient is diagnosed with acute and chronic respiratory failure. How should these conditions be sequenced according to ICD-10-CM guidelines? A. Code chronic respiratory failure first, followed by acute respiratory failure. B. Code only the acute respiratory failure. C. Code acute respiratory failure first, followed by chronic respiratory failure. D. Code only the chronic respiratory failure. Answer: C. Code acute respiratory failure first, followed by chronic respiratory failure. This question tests the ICD-10-CM sequencing guideline for acute and chronic conditions. The key is recognizing that when the same condition is described as both acute, meaning sudden onset or severe, and chronic, meaning long-lasting, the guidelines state you should sequence the code for the acute condition first. This rule ensures that the most immediate and severe aspect of the patient's illness is highlighted as the primary reason for the encounter. For instance, you would report J96.0, acute respiratory failure, before J96.1, chronic respiratory failure. Always remember the general rule, acute before chronic. Question 6. The term nephrolithiasis refers to what condition? A. Inflammation of the kidney. B. Stones in the kidney. C. Hardening of the kidney. D. Surgical removal of the kidney. Answer: B. Stones in the kidney. This question assesses your knowledge of medical terminology, a foundational skill for any coder. The key is to break down the word nephrolithiasis into its root parts. Nephro- means kidney, and lithiasis means the presence of stones. Combining these parts translates the term to stones in the kidney. Understanding common prefixes, suffixes, and root words is essential for correctly interpreting physician documentation and selecting the right codes. A helpful tip is to create flashcards for common medical root words. It will make translating complex terms much faster. Question 7. A patient undergoes a complete right heart catheterization and a left heart catheterization with coronary angiography. How would you code this? A. Report the code for a combined right and left heart catheterization. B. Report the code for a right heart catheterization and a separate code for the left heart catheterization. C. Report only the code for the left heart catheterization as it is more extensive. D. Report the code for a right heart catheterization and append modifier 51. Answer: A. Report the code for a combined right and left heart catheterization. This question tests your understanding of CPT coding for cardiovascular procedures, specifically combination codes. The key clue is that both a right heart and a left heart catheterization were performed during the same session. CPT provides a specific, single code for a combined right and left heart catheterization, e.g., 93460, which is more efficient and accurate than reporting the two procedures separately. Using the combination code prevents unbundling, which is the incorrect practice of billing separately for procedures that are covered by a single, more comprehensive code. Always look for a combination code first when multiple related procedures are performed in the same session. Question 8. In the CPT manual, where would you find the code for an initial inpatient psychiatric evaluation? A. In the surgery section. B. in the medicine section. C. In the evaluation and management section. D. In the pathology and laboratory section. Answer: B. In the medicine section. This question tests your knowledge of the CPT manual's layout and where to locate specific services. While psychiatric services involve evaluation and management, the specific codes for these services, such as psychotherapy and psychiatric diagnostic evaluations, e.g., 90792, are located in the psychiatry subsection of the medicine section. This is a common point of confusion for new coders who might look in the main E/M section. It's crucial to be familiar with the major sections of the CPT manual to find codes efficiently. A good habit is to tab the first page of each major section and subsection in your CPT book for quick reference during an exam. Question 9. A patient with end-stage renal disease, ESRD, is seen for anemia. The provider documents anemia in ESRD. How should this be coded in ICD-10-CM? A. Code ESRD first, then the code for anemia. B. Code anemia first, then the code for ESRD. C. Code only for ESRD. D. Code only for anemia. Answer: A. Code ESRD first, then the code for anemia. This scenario tests the ICD-10-CM guideline for coding anemia associated with chronic kidney disease, CKD. The key phrase is anemia in ESRD, which establishes a direct relationship between the two conditions. The official guidelines instruct that when anemia is caused by CKD, including ESRD, the code for the underlying CKD, N18.6 for ESRD, must be sequenced first, followed by the code for the anemia, D63.1. This sequencing rule highlights the cause and effect relationship, with the underlying disease listed before its manifestation. Always check the instructional notes in the ICD-10-CM tabular list, as they often provide these crucial sequencing directives. Question 10. A physician performs a cystourethropy and removes a 1.5 cm bladder tumor. Which CPT code should be reported? A. 52224. B. 52234. C. 52235. D. 52240. Answer: B. 52234. This question requires you to code a surgical procedure based on size, which is a common factor in CPT code selection. The key details are the procedure, cystourethropy with tumor removal, and the size of the tumor, 1.5 centimeters. In the CPT manual, codes for bladder tumor resection are differentiated by size. Small tumors, 0.5 centimeters to 2.0 centimeters, are reported with 52234, medium tumors, 2.0 to 5.0 centimeters, are reported with 52235, and large tumors, over 5.0 centimeters, are reported with 52240. Since 1.5 centimeters falls within the small range, 52234 is the correct code. Pay close attention to size, depth, and location details in operative reports, as they are critical for choosing the most specific code. Question 11. Which organization developed and maintains the CPT coding system? A. Centers for Medicare and Medicaid Services, CMS. B. World Health Organization, WHO. C. American Medical Association, AMA. D. American Academy of Professional Coders, AAPC. Answer: C. American Medical Association, AMA. This is a fundamental knowledge question about the governing bodies in medical coding. The key is to correctly associate the coding system with its developer. The American Medical Association, AMA, holds the copyright for, develops, and maintains the current procedural terminology, CPT, code set, which is used to report medical, surgical, and diagnostic procedures and services. While CMS uses CPT codes for Medicare billing and AAPC certifies coders, the AMA is the source of the CPT system itself. Remembering this helps you know where to look for official CPT guidelines and updates. Question 12. During a laparoscopic cholecystectomy, the surgeon decides the procedure is too complex and converts to an open cholecystectomy. How should the surgical procedure be coded? A. Code both the laparoscopic and open procedures. B. Code only the laparoscopic procedure. C. Code only the open procedure. D. Code the laparoscopic procedure with a modifier indicating a discontinued procedure. Answer: C. Code only the open procedure. This question tests the coding rule for a surgical procedure that is converted from one approach to another, such as laparoscopic to open. The key is the conversion to an open procedure. The established CPT guideline states that when a procedure begins with one approach, e.g., laparoscopic, and is then converted to a more extensive approach, e.g., open, you should only report the code for the successfully completed final procedure. In this case, only the open cholecystectomy is coded because it represents the definitive service performed. Think of it this way: you only code for the procedure that ultimately fixed the problem. Question 13. A patient receives a single injection of penicillin G. Which HCPCS Level II code series would be used to report the drug itself? A. A codes. B. C codes. C. J codes. D. L codes. Answer: C. J codes. This question tests your knowledge of HCPCS Level II code categories. The key detail is the service being reported, an injection of penicillin G, which is a drug administered by a healthcare professional. The J-code section of HCPCS Level II is specifically designated for drugs that are not typically self-administered, as well as for chemotherapy drugs. Therefore, the penicillin G supply would be reported with a J-code, while the administration of the injection would be reported with a separate CPT code. Knowing the general categories of HCPCS codes, e.g., J for drugs, L for orthotics, E for durable medical equipment, is essential for efficient coding. Question 14. What does the term contralateral mean? A. Affecting the same side of the body. B. Affecting the opposite side of the body. C. Affecting the front of the body. D. Affecting the back of the body. Answer: B. Affecting the opposite side of the body. This question tests your understanding of essential anatomical and directional terms. The key term is contralateral, which is used to describe something occurring on or affecting the opposite side of the body relative to a reference point. Its counterpart is ipsilateral, which means on the same side. For example, if a patient has a stroke on the left side of their brain that causes paralysis on the right side of their body, the paralysis is contralateral to the brain injury. Remembering these directional terms is crucial for correctly applying laterality concepts in both ICD-10-CM and CPT coding. Question 15. A pathologist examines a tissue specimen from a skin biopsy. The examination involves gross and microscopic analysis. Which section of the CPT manual contains the codes for this service? A. Surgery. B. Integumentary system. C. Medicine. D. Pathology and laboratory. Answer: D. Pathology and laboratory. This question is about navigating the CPT manual to find the correct section for a specific service. The keywords pathologist, tissue specimen, and microscopic analysis point directly to a pathology service. All services related to the examination of tissues, fluids, and other specimens to determine the presence or nature of disease are found in the pathology and laboratory section. For this scenario, you would look in the surgical pathology subsection, codes 88,300 to 88,309, to find the appropriate code. A simple tip is to associate the provider type with the CPT section, surgeons with surgery, radiologists with radiology, and pathologists with pathology/lab. Question 16. A patient is seen in the emergency department for a 3.5 cm laceration on their forearm. The physician performs an intermediate repair. Which CPT code should be reported? A. 12,002. B. 12,031. C. 12,032. D. 12,042. Answer, C. 12032. This question tests your ability to select the correct wound repair code based on three key factors: classification, intermediate, anatomical location, forearm, and size, 3.5 centimeters. First, you locate the repair, intermediate subsection in the CPT manual and find the codes for scalp, axilla, trunk, and/or extremities, which includes the forearm. Within that group, code 12031 is for repairs 2.5 centimeters or less, and code 12,032 is for repairs from 2.6 centimeters to 7.5 centimeters. Since the 3.5 centimeters laceration falls squarely within the range for code 12032, it is the correct choice. Always make sure you're in the right section for both the type of repair and body area before you even look at the sizes. Question 17. Which modifier is used to indicate that an evaluation and management (E/M) service was significant and separately identifiable from another procedure performed on the same day by the same physician? A. 24. B. 25. C. 57. D. 59. Answer, B. 25. This question tests your knowledge of a critical E/M modifier. The key phrase is significant and separately identifiable E/M service performed on the same day as a minor procedure. Modifier 25 is appended to the E/M code to signify that the patient's condition required an E/M service above and beyond the usual preoperative and postoperative care associated with the procedure. For example, if a patient comes in for a scheduled wart removal but also has the physician evaluate and manage their uncontrolled high blood pressure, modifier 25 would be added to the office visit code. Remember, the E/M service must be medically necessary and documented separately from the procedure itself. Question 18. A patient undergoes a total abdominal hysterectomy with bilateral salpingo-oophorectomy. Which of the following best describes this procedure? A. Surgical removal of the uterus only. B. Surgical removal of the uterus, cervix, fallopian tubes, and ovaries. C. Surgical removal of the fallopian tubes and ovaries only. D. Surgical repair of the uterus and ovaries. Answer, B. Surgical removal of the uterus, cervix, fallopian tubes, and ovaries. This question tests your ability to translate a procedural description using medical terminology. You must break down the terms. Hysterectomy is the surgical removal of the uterus, a total hysterectomy also includes the cervix, and bilateral salpingo-oophorectomy is the removal of both, meaning two, fallopian tubes, salpingo- and ovaries, oophore-. Therefore, the full procedure is the removal of the uterus, cervix, both fallopian tubes, and both ovaries. Being able to deconstruct complex medical terms is a vital skill for accurate procedural coding. Question 19. According to ICD-10-CM guidelines, what is the purpose of the placeholder character X? A. To indicate that a code is experimental. B. To allow for future expansion of a code category. C. To mark a code as a manifestation of another disease. D. To serve as a fifth character for certain 6-character codes. Answer B. To allow for future expansion of a code category. This question tests your knowledge of ICD-10-CM coding conventions. The primary role of the placeholder X is to fill empty character spaces within a code that requires a 7th character for additional specificity, but doesn't have a 4th, 5th, or 6th character. For example, encoding a toxic effect of a substance, such as T42.3X1A, poisoning by barbiturates, accidental, initial encounter, the X is used as a placeholder in the 5th position so the 7th character A can be correctly placed to indicate the initial encounter. A helpful tip is to think of X as simply saving a spot for a future, more specific code or holding the place so a 7th character can be added. Question 20. A surgeon performs a procedure that is listed in the CPT manual as a separate procedure. When is it appropriate to bill for a code designated as a separate procedure? A. Anytime it is performed with another procedure. B. Only when it is the only procedure performed in that anatomical area. C. When it is performed with a related major service. D. It should never be billed separately. Answer B. Only when it is the only procedure performed in that anatomical area. This question tests the CPT guideline for codes designated as a separate procedure. The key is understanding that this designation means the procedure is normally considered an integral part of a more extensive procedure and is not typically coded separately. However, it can be reported if it is the only procedure performed, if it's performed in a different operative session, or if it is unrelated to the major procedure, e.g., in a different anatomical location. For example, a diagnostic endoscopy is often included in a surgical endoscopy, but if only the diagnostic scope is performed, it would be appropriate to report that separate procedure code. Think of separate procedure as a warning label. Don't bill me with a bigger procedure in the same area unless there's a special reason. Question 21. Which part of Medicare provides coverage for prescription drugs? A. Part A. B. Part B. C. Part C. D. Part D. Answer D. Part D. This is a fundamental question about the structure of the Medicare program. Each part of Medicare covers different types of healthcare services. Medicare Part D is the program that provides outpatient prescription drug coverage, which is offered through private insurance companies approved by Medicare. In contrast, Part A covers inpatient hospital care, Part B covers physician services and outpatient care, and Part C, Medicare Advantage, is a bundle plan that includes Parts A, B, and often D. An easy way to remember is D is for drugs. Question 22. A patient undergoes a therapeutic infusion of saline for 90 minutes. How would you code for the infusion time? A. 1 code for the first hour and 1 code for the additional 30 minutes. B. 1 code for the initial hour only. C. 1 code for the total 90 minutes. D. 1 code for each 30-minute interval. Answer B. 1 code for the initial hour only. This question tests the specific time-based coding rules for hydration infusions. The key details are that the service is a therapeutic infusion and the duration is 90 minutes. The CPT code for initial hydration, 96360, covers the first 31 to 60 minutes of the service. The add-on code, 96361, is used for each additional hour, but the guideline specifies it can only be reported for intervals of more than 30 minutes beyond the preceding hour. Since the remaining time is exactly 30 minutes, which is not more than 30, the add-on code cannot be used, so only the initial hour is billable. Always read time-based coding rules very carefully. Words like up to, each additional, and more than are critical for accuracy. Question 23. A patient has a malignant neoplasm of the upper outer quadrant of the left breast. Which ICD-10-CM code correctly reports this diagnosis? A. C50.412. B. C50.511. C. C50.422. D. C50.919. Answer: A. C50.412. This question tests your ability to select a highly specific ICD-10-CM code that requires careful attention to laterality and anatomical location. The keywords are malignant neoplasm, upper outer quadrant, and left breast. In the ICD-10-CM tabular list under category C50, malignant neoplasm of breast, you must find the subcategory for the upper outer quadrant, which is C50.4. The sixth character specifies laterality, 1 for the right breast and 2 for the left breast. Therefore, C50.412 correctly captures all the specified details. C50.4, upper outer quadrant, the 1 in the 5th position for female, and the 2 in the 6th position for the left side. When coding neoplasms, never stop at the basic category, always code to the highest level of specificity available for location and laterality. Question 24. Modifier 51, multiple procedures, should be appended to which procedure code when multiple surgeries are performed during the same session? A. To the most extensive or highest valued procedure. B. To all secondary surgical procedures performed. C. To all surgical procedures, including the primary one. D. To the E/M service provided on the same day. Answer: B. To all secondary surgical procedures performed. This question tests the correct application of modifier 51, which is used to identify multiple procedures performed during the same operative session. The rule is that the primary procedure, the one with the highest relative value, is listed first on the claim without a modifier. Modifier 51 is then appended to the CPT codes for all subsequent or secondary surgical procedures to indicate they were performed at the same session. This signals to the payer that a multiple procedure payment reduction should be applied to the lesser valued services. Think of it as telling the payer, this was the main surgery, and these other ones were also done at the same time. Question 25. A 45-year-old patient undergoes an open reduction and internal fixation, ORIF, for a displaced fracture of the right radial styloid process. Which CPT code should be reported? A. 25,605. B. 25,607. C. 25,635. D. 25,645. Answer: B. 25607. This question requires you to code an orthopedic procedure based on the type of fracture, the treatment method, and the specific anatomical site. The key terms are open reduction and internal fixation, ORIF, right, and radial styloid process. In the CPT manual's musculoskeletal section, you would first locate the codes for fractures of the radius. Code 25607 specifically describes an open treatment, ORIF, of a radial styloid process fracture, which precisely matches the documentation. The other codes represent different treatments, e.g., closed treatment, or different fracture locations. Always match the treatment type, open versus closed, the fixation method, with or without internal fixation, and the precise bone involved to find the correct code.